Now, how do I add Leah?
So I think if you go to her and you go to the right of her where it says more.
Okay, let me just see if I can see all the attendees. Leah. Do I just go allow to talk?
Yep.
Allow to talk, and you can also do allow to be panelist.
Okay.
Oh, there.
Hello?
Hi, Leah. Great. Okay.
Perfect. We have her.
Wonderful.
Okay. I will just do a quick introduction. This is all very weird to do these things on Zoom. I don't see people. I can't see your responses, but we'll move forward. So it's my pleasure to introduce Dr. Jordan Woodworth. She's a veterinarian and clinical associate with the Wellness and Remote Clinical Practice at the Western College of Veterinary Medicine. She's also doing her PhD at this time and has worked in Northern Saskatchewan for many years. Speaking with her is Leah Arcand, and I will read her bio because it's very impressive. Not that Jordan's isn't, but I can't remember it all. Leah is Cree Saltu Iskru from Muskeg Lake Cree Nation in Saskatchewan. She also has ties to the Cote First Nation Saskatchewan and is based in Saskatoon now, which is located on Treaty 6 territory. Leah is a mother, educator, grassroots organizer, and activist, and founded Save Res Dogs while on maternity leave. She didn't have enough to do, I guess. Save Res Dogs is an advocacy educational group focused on animal welfare of res dogs in First Nations communities. It's a grassroots organization that is 100% volunteer run, that raises money through crowdfunding and by selling merchandise to fund animal rescue groups and to help low-income families with vet bills. So it's a great pleasure to meet you both, and I will let you go ahead with it, Jordan.
Thank you.
Hey, thanks very much. So I'm just going to start out here and then pass it over to Leah right away. So we're joining you together but separately from Saskatoon, which is in Treaty 6 territory, and I've been a happy visitor and settler here for my whole life, and really, feel really strongly tied to Saskatchewan, and have spent a lot of my life in northern Saskatchewan as well. So feel pretty tied up there, and I'll give you more details on that later. So what we're going to talk to you folks about today is first aid and reproductive health for dogs. Because we are both sort of coming from a Saskatchewan context, that's going to be mainly where we're speaking to you from as far as our lens. But I think a lot of what we have to say applies all over the place. As far as an outline today, I'm hoping that my screen will advance. I'm just going to see. There we are. So we're going to give you a little introduction, some of what you've already heard. We're going to talk about dog first aid, and we've kind of split it a little bit, not to be dichotomous, but into, how we think about these things from a veterinary standpoint, and then how community might think of those things. Both about dog first aid and about dog reproductive health, talking about some needs of communities, which I'm sure anyone who lives, works, and works alongside communities who have self-identified issues with dogs will identify with some of these needs, some opportunities that are, have already been touched on, some today that we'll expand on hopefully, and then we're hoping to have some discussion. So there's a few questions sort of peppered throughout our presentation that we're hoping that folks will be able to engage with us on. So I'm going to pass it over to Leah now, and she'll tell us about herself.
Hi, thank you, Jordan. Thank you, Susan, for that introduction. Jordan, can you hear me okay?
Yes, I can.
Okay, just gotta see if I have to work on the volume of my voice. Thank you everyone for being here and listening to everyone's presentations. I'm sorry I didn't get to watch everyone so far, but I did catch on to the last bit before lunch on the illustrations, and those look great. So kudos for all of us for being here. I'm super passionate about res dogs. So I am Cree Soto from Muskeg Lake First Nation, and I live in Saskatoon. And I started Save Res Dogs when I was teaching in a First Nations community about 4 years ago called Thunderchild. And I was teaching a land-based program for grade 7-8 girls, and I've always just like really loved animals. And as I was working in the community, there was always community dogs coming to the school. Some were sort of just left on their own and unclaimed, and that's when me and my students would take it upon ourselves to feed them and make sure they had shelter and rehome some of them that needed rehoming. And at the same time, when I would go home, some of these dogs would follow me, which I was totally okay with. And just ended up like fostering at least like 7 dogs at a time. And so it just sort of became known in the community that I was very passionate about dogs, and would always, like most times, like message me for advice or for food or sort of anything res dog related. And so I would use my social media as a tool to get donations or to find new homes for some dogs. And I would use the hashtag #SaveResDogs. And after I was in Thunderchild for about 2.5 years, and then I got pregnant and was going on mat leave. So I was leaving the reserve, and people would still message me about anything, again, res dog related. So I felt like this is a need in our communities, because I'm also aware that there's no there's no services in our reserves, and like in Saskatchewan, especially where I'm from, on my mom's side and my dad's side. So last summer, I launched a Facebook page called Save Res Dogs with this logo, and then it led to Instagram and Twitter, and then I got merch made, and I would donate some of the proceeds to families who needed help with vet bills, and I'd also use some of the money to get more merch. And it was just sort of raising awareness and building like my brand as an advocacy and education group. So that's sort of where it comes from, basically. So yeah, hope that makes sense. If you have, oh, and so that's me. And these are some of the mamas in Thunderchild that I would always keep an eye out for. The middle one is Birdie, and her baby I called Baby Bird. And then there's Smeagol's, and she had about 9 puppies. So she was sort of like one of the main reasons why I wanted to start like Save Res Dogs, because she's sort of just has a special place in my heart. And with her story too, as being like a community free roaming dog and being in heat and having like a litter. Each of these dogs had a litter every year. And so I talked to one of the local vets about like any tips or advice. And one tip was to like sell the pups for a certain fee. And I took that idea and sold each puppy to help pay for her spay, because when she was in heat, it was just super traumatic, and it would attract all sorts of wild and stray dogs around, and it became very unsafe. So yeah, so Smeagol's is just sort of the reason, and Birdie are the reasons why I started Save Res Dogs. And because they also represent like being the most vulnerable members in our indigenous communities as well. Is that good, Jordan? Should I just keep going?
Yes, absolutely.
Okay. So I kind of just wanted to touch a bit about, wait, Jordan, how could I see my speaker notes, or do I just?
You might have to pull it up on your screen there, Leah, sorry.
No, it's all good. It is all good. Just bear with me a second. Okay. Okay, so as most of you know, like well, I think anyways, like traditionally dogs have had important roles in our communities and in our families and in our whole nations. And they were treated differently in the times of like our mushums and cookums because they had jobs to do. But I've heard stories from various like credible people about dogs and their roles in the prairies. Like before, when horses came, dogs pulled our sleds and carry our loads, and they protected our camps and alerted, you know, people when others were coming, and they helped hunt and track for food. So it's like pre-colonial times, like dogs were very valued members. And so due to colonialism, like it's very much disrupted our relationships, and our communities are just sort of picking up the pieces and are kind of sometimes stuck in a mess because of colonialism. And dogs are usually like left not prioritized at all. Oh, hello? Oh, okay, sorry, I had a call come in, which leads to the dog's different roles. Like the discourse in our communities right now about dogs is completely different from their traditional roles. So like dogs are seen now as like, you know, sort of pests in some of the eyes of, you know, leadership, because it's the overpopulation has become so out of hand, and res dogs have sort of become the butt of many jokes and stuff. But on the other side, there are people who care a lot about res dogs and take care of them. But I feel like Indigenous communities, we've lost sight of their roles and how valuable they are. So yeah, I'll just sort of leave it at that for now.
Thanks, Leah. And, you know, I think that that's an important thing to talk about right off the hop, and it ties into what the McQueen Reeds were talking about earlier in terms of the, you know, the historical and traditional roles of dogs and how that's changed. But really sort of, you know, talking about some of the root causes of that, I think is really important. So I'll flip gears just for a second and talk about myself and why I'm talking about this topic with Leah. So as I mentioned, I grew up in Saskatoon, and I graduated from the Western College of Vet Medicine in 2008. And I had plans on what I was going to do when I graduated, and they did not actually involve me going into academia or going back to work at a university at all. But it's where I ended up. So after working in general practice, small animal general practice for 4 years, I took a job at the WCVM, sort of creating and delivering a couple of new clinical programs for fourth-year senior vet students. And so, like Susan mentioned in the bio, one of them is focused on preventive healthcare for dogs and cats, and then the other one involves delivery of spay, neuter, and vaccine clinics for cats and dogs in La Ronge, which is about 400 kilometers north of Saskatoon and 250 kilometers north of the nearest vet clinic. So this 2020 would have been our 7th year doing these clinics, but of course COVID had different plans. So our clinics had to be canceled, like so many others I was seeing in the chat. And so we're sort of looking ahead to when we might be able to get back into the community. We get lots of requests, both from that community and from other communities around Saskatchewan, to come in and help with animal populations. So lots of need, as I'm sure all involved in this conference can attest. So I also have 2 kids and a husband and a small dog who started out life around the La Ronge area. And like Susan mentioned, I'm working on a PhD while I continue to work half-time at the WCVM. So my research is asking questions about dog management in communities without regular access to vet care. And it's specifically a community-driven project, which involves work with a community-based research team and advisory circle. So it's not my project, it's our project. And we're sort of, working out not only how to answer our questions, but also how to work on a team, particularly when we all live in different areas. So it's an interesting process and really fun and rewarding all at the same time. So I really love my job, and I love what I'm doing with my life, and the aspects I'm most passionate about definitely surround this partnership kind of stuff with individuals and communities that, you know, helps to improve the lives of people and animals everywhere, which I think as veterinary professionals, usually that's what we're all about. So yeah, I think that Leah's work is, you know, something that creates a lot of opportunities for communities to access the support they need and want. And Leah does that in a culturally safe and trust building way. So I think that's something really important to showcase here. So I just wanted to take 2 minutes and talk quickly about, you know, this term underserved. We're talking about communities and I guess animal populations as being underserved. And I just wanted to talk about that there are lots of different reasons why communities might be underserved when it comes to veterinary medicine or animal health care. Geography is only one of those things that can play a role there, right? So there are lots of different determinants of animal health, just the same as there are lots of determinants of human health. And our colleagues Claire and Tasha and Michelle did some really interesting work that kind of illustrated the crossover there. And I think that's an important thing for us to think about, again, as animal health professionals and for folks who are wanting to get involved in this work, right? There are lots of things that play into this, you know, how we determine animal health as well as access to animal health care. We also still don't have a standard definition or assessment tool for communities or individuals regarding access to vet care. So, you know, this paper on the bottom just shows you that it was back in 1975 that the Index of Medical Underservice on the human health side was developed. So that's almost 50 years ago. And here we are on the veterinary side without such tools. And so I think that some of this might have to do with the fact that, you know, the world doesn't always view access to vet care as a public health issue. And I strongly believe that it is that, and you know, should be treated as such. So, you know, the discussions around funding for different animal health care programs, I think a lot of that comes back to how we frame these things when we're looking for funding. And the more that we can think of them as a One Health and public health, you know, phenomenon, I think the more doors might open in that way. So, yeah, and again, back to the partnership thing, I just really believe that if we want to help make change, we need to work with, together, right, as animal health professionals and as community members to find creative solutions. And I know that there are lots of creative solutions out there, whether it's within sort of our sort of country or internationally. And there's lots of really great things. So I look forward to hearing what others involved in this call might have to say as we move on. So I guess, you know, thinking about dog first aid and how veterinarians think about dog first aid. So we're often seen by ourselves, but also as others, as the gatekeepers of animal medical care. And I don't mean just veterinarians, but any, you know, veterinary professionals. So this includes registered veterinary technologists and animal health care technicians. And, you know, we might have our own ideas about how emergencies in these underserved communities might look. So I think the perception often is, you know, an injury to an animal happens, somebody in that community contacts their nearest veterinarian, whoever that might be. The vet maybe gives advice over the phone with or without a valid veterinary client-patient relationship, which is a legal matter. Maybe that owner or community member might do what they can to help, often feeling disempowered because they may not have the training necessary to do that. The dog may or may not recover, and then maybe the cycle continues. But as Leah will talk about, right, you know, sometimes that's not what happens. Sometimes people don't feel like they can reach out to vets, and then there's another route that's taken. Did you want to jump in, Leah?
Yeah, for sure. So, like, all the points I'm kind of talking about is just based off personal experience with, say, res dogs in the past, past year or so. And, like, yeah, when people I've gotten so many messages about various things and stuff that I have no experience on. So that's how I always get in touch with Jordan. But I always just get a sense of hopelessness from people in our communities because, yeah, the discourse in our community is that they'll just go get shot kind of thing. Or if you can't take care of a dog, why have it? So people just don't even know what to do or where to go because there's such a negative stigma around res dogs. And then thinking that everything's going to be super expensive. So sometimes people just don't even want to try. So it's super unfortunate, but I don't mind taking it on to like help people, even if it's just a sounding board or just pointing them in a direction where to go. And that's why I also help with the financial relief as well, because it helps lighten the load on their end. Yeah.
Yeah.
Mm-hmm.
Thank you very much. And so, you know, this idea that vets have about how these things might roll out in communities, you know, certainly even if it did roll that way, it doesn't work in emergencies when there's no one around, right, that who can help. And I guess, you know, like we're talking about with all of the presentations today, though a lot of vets and vet professionals want to help, we can't be everywhere at once. So things like telemedicine and telehealth certainly provide some help, but there are lots of gaps there and not everything can be solved that way. So I think this is where we get into conversations of what are some of the opportunities, and we'll touch on those later, but certainly those have come up in the chat already today, different ideas of how we might improve capacity in communities. And, you know, I was at a conference last year that was completely unrelated to veterinary medicine, but there was a discussion about capacity building in Indigenous communities. And it was in Halifax, and there was a Mi'kmaq woman who got up and she said, look, you need to stop talking about capacity building. Our communities have capacity. And I thought that was a really interesting you know, perspective shift, because I think a lot of times as outside folks and as helpers, we talk about like, how can we build capacity? A lot of time the capacity is there, and you know, sometimes we need to get out of the way a little bit. And so there are some different ways that I think, you know, we can do that, and obviously provide some support and empowerment where it's needed as well. So yeah, I think, you know, a lot of this stuff we're talking about emergencies, it doesn't always address the idea of preventive care in communities either, but that's kind of a different topic for a different presentation, and certainly something that needs to be discussed as well. Sorry, I'm just going to try and advance. There we go. Okay, that's you, Leah.
Okay, so kind of, thank you, Jordan. So kind of what I mentioned about Save Res Dogs is just, when I started it, I felt like it was a hotline and people messaging me various things that I didn't know what to do, so I would just Google. Like, someone messaged me, my Chihuahua was sick, what do I do? So I'm like, just trying to be as helpful as I can, because like I want to be, but I also am trying to give like proper information. So, but since it's been a little easier now that I've like made connections with veterinarians and people on the front lines with rescues and so forth. So, what was I going to say? Yeah. So what else?
Sorry.
Yeah, go ahead.
Yeah. So I think, you know, one of the things that we're like Leah's organization doing this kind of matchmaking, because one of the things, Leah, that you and I have certainly talked about is, you know, certainly you call me for advice sometimes and you call other veterinarians for advice, but a lot of times what you've been doing now that you kind of know what's out there for people is you're connecting people with organizations that can help them with the things that they need. Now, whether that's a veterinarian or whether that's, you know, a humane society or rescue organization who can come in and provide whatever support it is that they need. You know, being the middle person with sort of established trust, I think is extremely helpful. And because you've got that capacity to be able to provide financial support as well, I think that that's something that seems really valued by people out in communities.
Yes, yeah, for sure. Sorry, I lost my track of thought because I feel like I'm repeating myself. It just, but I'm probably not. But no, yeah, you're right. And it's the power of social media too. Like, since I've officially launched this, like the social media has been a great tool in like connecting and building networks, and, you know, having and coming from an Indigenous perspective as well is what I think like people can trust as well, because I don't think there's not too many like grassroots organizations like Save Res Dogs, which is sort of the reason why I started it. And it just sort of has taken a life on its own. So yeah, it's kind of, it's rewarding, but it's also exhausting at the same time, because there's just so many factors and layers with everything, because res dogs are it's a very political topic and cultural topic and educational topic. Like, it fits in every aspect in our community. So it's just trying to get like in our community and outside our community to understand like a lot of things. So yeah, so yeah, it's good.
Absolutely. Yeah, that information sharing is so crucial, right?
Mm-hmm.
Yeah, and that's the, like you say, the power of social media. It's so wonderful for spreading the message widely.
Mm-hmm.
So just a quick sort of touch on some of the issues surrounding dog first aid in underserved communities. So as I mentioned before, lots of times there are training limitations. And again, in the chat today, I've seen lots of discussion around this. So lots of people in underserved communities don't have adequate training to attend to medical emergencies with dogs, but obviously there are lots of folks who want to help and want to attend to these. So it can lead to a number of outcomes, right? Including, you know, people getting injured, or dogs not getting care for their illness or injury, or, you know, receiving care that might affect the safety and well-being of the people they live alongside, or whatever, right? But I think that, you know, there are a lot of ways that can be tackled, and we'll talk about that in sort of another slide. But supplies can also be an issue. I heard some people, or saw some people in the chat today talking about having first aid supply kits on hand. I think that's a wonderful idea, and something that when combined, excuse me, with training, can really open up doors for people to, at least a few people in the community, to feel empowered to attend to dog emergencies. I think as part of that training, safety is super important. So as we all know, anyone who's encountered an injured or sometimes ill dog, they can be quite painful and fearful as a result. So that can make them more difficult and dangerous to handle. So we don't want people who are attending to dog emergencies to get bitten, because that's obviously, you know, problematic from a number of different standpoints, you know, not the least of which is injury, but also, you know, transmission of diseases and things like that. But dog safety can also be threatened in those situations too. So, you know, talking about adequate supplies and training is crucial. Legislative limitations. So, you know, there are some things that can get in the way of community members attending to animal emergencies. A lot of it is sort of, you know, enthroned in local legislation. So certainly in Saskatchewan, we have the Veterinarians Act of Saskatchewan, and it specifies who can provide veterinary care. And, you know, as it turns out in our province, it is legal to provide first aid care to an animal, or provide an animal with medication, if it belongs to you or you have permission from their owner. That's as long as you, the person providing the service, are not being paid for it. So, and of course, there are certain things that are, you know, unique to the practice of veterinary medicine, such as, you know, doing spay-neuter surgeries and certain other things, prescribing medications. But definitely there are exemptions, and I think that those are ways that we can sort of, you know, again, open up some doors for folks in communities to have some ability to attend to these situations, particularly when veterinary service isn't available on a regular basis. So a few opportunities that I wanted to just throw out there, again, because we're talking about the potential to have trained individuals in communities who can provide some of these services. And again, this does not get into the conversation around preventive healthcare and providing vaccines and deworming and things like that, which is also hugely important. But just specifically talking about dog first aid. So these two companies, DogSafe and the American Red Cross, both have online training programs for lay people to learn about dog first aid. So they're both American-based companies, but they're available anywhere in the world for this online training. DogSafe looks pretty robust from what I can tell. They give a discount for groups of 2 or more. They've got downloadable manuals and course material that whomever purchases the course can save forever. You know, it looks like it's about a 4.5-hour course, and it's pretty comprehensive comprehensive, whereas the Red Cross program is 35 minutes, pretty short and sweet, not as comprehensive, but costs a lot less. And both organizations will, come to communities to do in-person training as well, but obviously that would be quite a bit more expensive. Now, to me, if we're talking about the potential to have folks trained, one of the things that Leah and I were chatting about as we were creating this presentation is, in communities that I've worked in, when you've got someone whose job it is to be the quote unquote dog catcher, right? When dogs are on the loose and causing a nuisance, that person's job is to go out and collect them and perhaps take them to the pound if there is one, and perhaps, give a fine to the person who let them run free. That person often tends to be a little bit alienated in the community, and it doesn't seem to be a job in a lot of places where people want to stick to that job for a very long time, because it's not very much fun to be policing your neighbors and your relatives. On the flip side of that, if that were also a person who had the ability to attend to animal emergencies and could support families when their dog was injured or ill, that might change the tone of that position in the community. And so that's something that I could certainly see being really helpful in a lot of places. This other link on the screen is from the Calgary Humane Society, and it's a DIY canine first aid kit. So it's supplies that you would want to have on hand for animal emergencies. And on their list, if they don't already have it, I would certainly add muzzles and other safety equipment to help prevent injuries when handling injured dogs. But it's a good place to start. And again, in smaller communities, having, one pet first aid kit. And I believe the University of Montreal had some really robust canine first aid kits that they were sharing a list of contents with folks as well. And so there are lots of lists out there, but having one of those available and having one or two folks in the community trained might really open up some doors. So yeah, there's a whole other discussion around community animal healthcare workers or environmental healthcare practitioners or paraveterinarians, as far as providing sort of more robust animal healthcare on an ongoing basis. But as far as first aid goes, I think that these types of training opportunities that, again, thanks to COVID, are now moved online are a really easy access way to get rolling with that.
Okay, so at this point in the chat, if anyone can share any ideas that worked when vet care wasn't available, we would love to pass on any of these ideas to those who live in remote areas who want to help but are limited, ideas and resources and services. So take this time now just to share anything that comes to mind. But yeah, in the meantime, as I've started Save Red's Dogs, it's just trying to be as helpful as I can and using Google or messaging Jordan or messaging another frontline worker from various rescues, such as Canine Action Project, which do great work in our Treaty 6 communities. But sometimes I feel there's taking on such a big burden that we should be, as in our communities, we need to take a handle of. And like Jordan said, it'd be great if there'd be trained staff in our communities, but it all comes down to money when it comes down to these decisions being made. And so if it costs too much money, then that idea is kind of scrapped. And so we're just we get stuck in the same perpetual violent cycle with dogs. So yeah, just in the chat, if you have ideas about creative solutions you encountered in your community that you use to manage dog emergencies in the absence of local vet care. Okay.
One of the things I'm seeing in the chat is, changing to legislation. And I think that's something that I think I have later in the presentation as well. And I think, anyone in the participant group who is a veterinarian or a registered vet tech, this is one of the things that's written into our code of ethics, is that we need to be altering legislation where it doesn't actually support animal health in the way that's best for everyone. And so I think that, this is somewhere that we can really use our power as licensed veterinarians and vet techs to make some change. So we're going to move on to talk about dog reproductive health. And I know there's lots of action happening in the chat, and I hope at the end we've got some time to talk more about that, because it looks like there's some really rich conversation happening that I can't pay attention to right now. So as far as dog reproductive health, I'm always curious about what that is, like what we mean by reproductive health, right? So reproductive health in humans is defined as physical and mental or emotional well-being around sexuality and reproduction. So in animals, though, the definitions of reproductive health depend on the animal's purpose from a human perspective and the human relationship with those animals. So reproductive health of dogs and other companion animals will often revolve around having the ability to reproduce when people want them to, and to also have reproduction prevented when humans want it to be. So in a lot of places that we're talking about today, population control or population management is the goal. So we need effective contraceptive strategies to achieve whatever reproductive health we're going for. So that can include different things like modifying opportunities for contact between intact males and in-heat females. Leah talked about how traumatic the experience of being around an intact female can be for people who've never experienced it before or don't know what's going on. Surgical alteration is the thing that is vets and vet professionals we talk about on a really regular basis. And then there's also that piece about chemical alteration. So I noticed in John and Julia's presentation that there weren't a lot of organizations in Canada that were providing chemical sterilization. And that's pretty common because of the fact that we don't have licensed drugs in Canada. So all the drugs that are available for that worldwide need to be accessed with an emergency drug release for use in companion animals here. And so it tends to be something that's not really used. But what I do know is that the companies that market a lot of these products are pretty darn willing to share them. And so there's lots of willingness and ability to access those medications, those products if need be. But the problem is that a lot of times those are not very effective or long-term. So, we tend to sort of grasp onto surgical alteration because of its permanent status. So yeah, I think that's, just something for us to remember. And culling and removal, I have that on the slide too, because culling and removal often are one of the strategies that are undertaken in communities that don't have access to veterinary care or to the surgical alteration of dogs.
Mm-hmm. And that's like part of, I guess, the discourse or what people want, or they think that's one of the only options too, but it's only like a Band-Aid solution. And that's what a lot of reserves kind of have for quote unquote animal control, is culling or removing them, and that's basically it. So, and I'm just trying to advocate to make changes about that, or just to reframe the conversation and just to sort of educate people and bring them back to dogs' traditional roles and them as valued members and family members. Yeah. But yeah, I just want to, I know I mentioned it before about dogs and heat and being traumatic. That happened to Smeagol's, and she didn't even look like herself. So it's just sort of, there's just so many Smeagol's like that in all of our communities, and the quick fix in our communities is to shoot them. And so it's super unnecessary. So I just wanted to say that. Okay.
Absolutely. Yeah. And I think, again, sort of talking about who defines reproductive health from a community perspective. So again, a lot of what I hear is, we're talking about, is the population of adult dogs and puppies manageable from a community perspective, right? Is the community overwhelmed by the number of dogs, or, are the resources that are needed to properly care for the dogs available? And a lot of times, whatever the sort of program is, or the initiative is, that is started to manage dog population is chosen based on a number of different things. So it can be focused on dog welfare, so it's a dog-centric strategy. It can be a human-centric strategy, or it could be focused on the effect of of dogs on the conservation of wildlife. So there are a lot of different ways or reasons why communities might be wanting to undertake management programs. So again, we talked about that there are a lot of different ways that dog reproduction can be managed, and it can be through changes in contact and behavior modification. Now, it tends to be a little bit more tricky, especially in communities where there's lots of close quarters, but it is a possibility, and reducing population can happen in a number of different ways. Yeah, I mean, I guess, things like dog polls, removing dogs from communities, sometimes on the surface can seem like a really good idea, but I'm sure anyone who's been involved in that can certainly attest to the fact that that's pretty resource intensive. And also, as Leah mentions, it can be problematic from a community perspective, because, there are little glimmers of things like the 60s scoop and residential schools, right, that happen when you come in and remove dogs from communities. Sometimes community leadership is on board with that dog removal program, but sometimes community members aren't. So there can be some tricky things that can come out of that, right? Do you have anything else you want to say about that, Leah?
No, absolutely. No, I totally agree about all that. When there's no community consultation, it's super problematic, and you have people in these leadership positions that really only last about 3 to 4 years because of election season, and then those rules change. So there's never any consistency, and the lack of consultation just leads to very problematic outcomes. And it's also just perpetuating this violent cycle that the kids see, that the youth see, and then they think that this treatment or doing nothing is normal. So it's all very much a ripple effect of things.
Yeah, and as you're kind of alluding to, it does have an effect on community well-being, right? So there's a lot of psychological effects of how dog health is sustained, and how that reflects on people's well-being in the community as well.
Yeah.
Okay, so this is Leah's slide.
Okay, so this past summer, my cousins and they were summer students. We spent about 2 to 3 weeks calling all the First Nation communities in Saskatchewan, and there's 74. And we only connected with 29 of them, but we sent emails, we left voicemails, we called all of them, but 29 were the only ones we got through. And this is sort of based from those small surveys that we conducted. And we just asked 5 to 6 simple questions about what's going well with dogs in the community, what's your current animal control management plan, what's your biggest challenge in the community with dogs, what resources do you have for those challenges, and what resources are you looking for, and what do you hope to achieve if those resources are available. So I thought they were pretty those are pretty easygoing questions, but a lot of the time the people we were connected with to talk to just really had no ideas or no simple answers. A lot of common answers we got about dogs in the communities is that some dogs have owners, the positive things were like dogs have owners, owners keep dogs in yard, and there's fewer strays. And a lot of people had nothing positive to say. For the current animal management plan question, the very common answer we had was they hire someone to quote unquote destroy dogs. So that's a very common animal control plan, which is very, unethical. Some of them are trying to implement bylaws, and some just have no animal management plan at all. So it's not even on people's radar. And some people we connected with, they thought, res dog, like they thought we were joking or it was funny. They're like res dogs, and they just didn't know who to pass us on to. But for the most part, we were connected with people in the health department, the lands department, the justice department, a couple counselors, or just like the receptionist. Those were the people we were talking to. And I'd say a handful of people were very receptive and very on board and checked out our website and wanted to do more for the res dogs, but didn't know where to start, is what I had discovered as well. But so, and another thing was, is like what people want, and this is also from like my personal opinion, is education. And that's part of why I started Save Res Dogs, was just to talk about and help like kids understand like the basic needs of dogs and how to take care of dogs, and also educating like owners or potential owners that dogs are a lifelong commitment, or their lifelong commitment, which is like 14 years, and it's expensive because people like the idea of having a puppy, but that only lasts so long, and that's super common. And that's why we see so many dogs roaming around after dogs are done their puppy phase. So just educating people on like how to take care of a dog and their basic needs, and just trying to help them understand that a dog needs space to roam around in, and that they probably shouldn't be on a leash 24/7 of the day, which is also very common. So education, another thing like that came to mind to Jordan after we were talking, is that, and that what we all can do is just sort of like promote and I guess get our young people to believe that they can be veterinarians one day down the road, so they can come back and help communities, because I think that's a huge need too. But some of the barriers is the education system, because a lot of times in our reserves, like the education is not, I guess, it's mainstream, but it's not as adequate as, off reserve schools because of funding. So there's so many factors and the main thing is like kids don't have access to all the science and math classes, and which would get them to go to, post-secondary schools to get to this education level. If that makes sense, Jordan. Does it make sense? Yeah.
It totally does. And I think, someone brought it up earlier today, the idea of providing like vet tech training programs for, folks in communities, and then having them stay in those communities and be, providing some support for animal health. And in a lot of places, vet techs can do a heck of a lot of things as long as they're in consultation with a veterinarian. So even, especially with things like telemedicine, telehealth, if a veterinarian were outside the community, but there was a tech within the community, there's a lot more that can be done. And so, like you and I have been discussing, Leah, vet tech training being a 2-year program, it's something that is like a quicker sort of educational goal for a lot of folks, and it would allow people to sort of be on the ground and providing that service in a fairly short period of time once they're finished their high school. So, but as you mentioned, you know, lots of times because reserve schools are hugely underfunded as compared to provincial schools, or I don't know about in the territories. That can be a problem. And I know that there's a big issue with reserve schools having access to STEM, so science, technology, engineering, and math programming. And so that can be a big barrier for someone who's wanting to get into a program like vet med or vet tech. So.
Yeah, I just feel like kids just, well, they love dogs, but sometimes they can't see that far enough to be like, oh, I can be a vet, because of lack of resources and services. So mentorships, or even like I guess when COVID's over, like school trips to a vet college kind of thing, or volunteering with the rescue. Like there's so many ideas out there that we're missing, right? We're missing opportunities to sort of help our youth, sort of help in the bigger picture of things, you know, to help them give a purpose. And ways to give back to the community once they're older. So, yeah.
Yeah, absolutely. And I just saw in the chat, Dr. Bender, who I think I heard earlier is from Arizona, is just sharing a link for a First Nation University vet tech program. And so that's something that I think it'd be great if we could, take a lead from that program in Canada as well. So
back to the survey and some of the needs that community or the community want, and this was kind of funny, not funny, eye-rolling moment, is when the workers were like, yeah, it'd be great if the vets could just run a free clinic every now and then. I would explain to them, like, as quickly as I could, that well, there's no way that they're going to work for free, and vet clinics cost a lot of money. So it's just trying to reframe this old way of thinking, and I don't know, it was funny and frustrating at the same time. So it's just sort of educating people as well, and knowing that there's more to it than just vet clinics, and there's like keeping owners accountable on the res, but that is also can be tricky too, because who wants to be told how to take care of their dog on the reserve kind of thing? I don't know. There's so many layers, and even with my own reserve, it can be really frustrating because and based on the surveys too, there's just a lot of complacency. But I feel like that's an old school, old way of thinking. You know, that's sort of the older generation. But we have this new generation coming up that's, taking more of a progressive stance and trying to make things right and better and ethical, and not just going down the direction of shooting dogs or and so forth. So another community need down here was grooming tips, like how to clip nails on a budget, or shampooing, or getting rid of mange, or applying tick medicine, so seasonal stuff that come up, or porcupine quills. People don't have access, or people don't know, or there's so many different directions in this, right? But that's why, like with Save Res Dogs, because everyone's on social media, like I can put this on my page and my website, and so all Instagram and Twitter, so people can see it. Like I've been trying to take the information that I got to create content that will help these demographics, especially I think about in the northern communities who don't have access to these things. And I really feel for them in northern Saskatchewan, because they're like 6-7 hours away from the nearest town. But I get frustrated with the the reserves around the towns and cities, because they're the ones who can have access to some of these services, but they choose a different route most times, which includes like hiring someone to destroy dogs, or not having bylaws, or not trying to have bylaws. So that's where I get super frustrated. And I make memes. Lately, I've been making memes and putting them on my social media. So if you go to my social media, you can see some of the stuff that I'll be posting later. But I don't know, it's a lot, and it's a lot of passionate, frustrating, rewarding work. But I'm super thankful that through Save Res Dogs, I've been able to like build a network of other dog lovers and people who want to help, like Canine Action Project or Save a Dog Network or Cochin Rescue Society, who all are very helpful and respectful to the needs of the community. So if you're out there in the crowd, thank you very much.
Awesome. I'm just noticing in the chat there's some there was a question about bylaws, and I think that's one of the things that in your your one sheet flyers that you have, like I think it's like something about 10 ways to support res dogs, right?
Yeah.
Bylaws is one of the things you talk about, and Leah's got a really great example bylaw on her website as well, under the resources section. That's really wonderful. It's from Ermine Skin Creation, and it's a really robust local bylaw. So that's I've certainly, if communities that have reached out to me for asking questions, that's one of the places that I've directed them is to that bylaw, just as an example of what communities could put in place. Now that said, implementing bylaws on First Nations can be tricky because there's a lot of red tape. So that there are, it's not a straightforward issue always, and it can take a lot of time and effort. So, but having something that's a really good example can be a good place for people to start.
Yeah, for sure. I send that template from Ermine Skin First Nation from Josh Littlechild. He's the champion officer out there for dogs. He sent that to me and said it's a public document online, and it's regarded one of the highest bylaws on a reserve in Canada. So it's on my website under the resources. But yeah, so I have, when I was doing these surveys, I make sure people know this information, and I wish people see it, but again, it would come down to money, because they're like, well, it would just cost too much money to hire someone to do that, or no one's properly trained to handle dogs in certain situations. So, in a perfect world, when I think about my own reserve, well, just to have someone on staff from a certain department. It could be lands, yeah, or public works, and they have some training or some education in this area, and so that person would be the person people would go to for dog emergencies. So in a perfect world, but it's lack of funding in most cases. But I think in other cases, our leadership just wants the easy way out, I guess, which is super unfortunate. So
I think so. I think sometimes there's things that are taking people's attention that seem more urgent, right, than what's going on with dogs.
And it's back to my colonialism thing, or my colonialism slide, is that we are faced with so many burdens, where we have to prioritize the needs of children and our elders and our health and safety and education and housing. So we have so many things to sort of pick up and handle, and dogs are always left in the dust, and they continue to still be left in the dust in most cases. So I do what I can, and people will take on what they can too at the same time.
Yeah, absolutely.
Mm-hmm.
So this is kind of our last content slide before there's time for more discussion. But I just wanted to mention, so I know that both Tasha and Jasmine are participating, and they're sort of people who I look to for their expertise. Tasha's my PhD supervisor, and Jasmine did her PhD with Tasha previously. And so they developed this community dog book in 2018, and it's a resource that, again, Leah has linked on her website. But it's a resource that sort of guides communities through figuring out what their dog issues are, so defining their local dog issues and figuring out how they might want to go about starting to address that. So it's a step-by-step book with a bunch of different modules in it, and it's a way that community leadership, or perhaps just a group of champions or a champion in the community, can kind of get rolling on what it is that the community wants to do, because oftentimes, you know, that's how folks figure out what's going to sort of be most useful and most sustainable at home. And I saw Claire posted a comment earlier that it's up, you know, communities need to define for themselves what it is that they need. And I completely agree with that. That's really necessary. Lots of times I think, you know, folks don't even know where to begin, like Leah's been saying. So this is a resource that can at least help them kind of get started. And have a place to begin. So, you know, it can prompt a lot of discussions locally as well, which is really, really important for kind of bringing this idea of dogs being important to the forefront.
And I have this hope and idea that people can do this in schools and get the youth involved, because they would be so gung-ho on helping dogs, but they need like adults to help them get or reach goals in certain areas. And also, like, the youth would be like such a great mover in like changing a lot of things and changing the minds of chief and councils, because chief and councils are always using youth in their speeches. So that's why I'm always thinking like, well, I have to like get the youth on board, and so we can start putting pressure on like newly elected chief and councils and their staff and department managers. Because I think right now, for the most part, people in those positions are a generation, an older generation. So like, it's kind of me throwing shade, but it's just that old school way of thinking, which have kept us in this sort of position, right? So it's just sort of encouraging this new, younger, progressive generation to start making changes and saying like, this isn't okay anymore.
Yeah, absolutely. Absolutely. So yeah, I mean, I guess like we're talking about, you know, what can communities do? What can vets do? I think for vets, you know, everybody on this call kind of, I think gets it for the most part, but I think just that idea of true partnership and not, you know, coming in with our own ideas and telling communities what they need to do, because that's generally not going to be sustainable. So being true partners in sort of developing programming and rolling it out, and being willing to, you know, make it change over time, because everything has to evolve in response to ongoing community needs, and those change over time and often in very short periods of time. So being open to that and being flexible. And then for other organizations, I know lots of folks are working with rescue organizations or humane societies on here. And it sounds like from what I'm seeing in the chat that everybody's already on board with, you know, it's necessary to, you know, have everybody, you know, have an idea of where they're coming from culturally. So have your own cultural humility, have some cultural sensitivity, and you know, maybe even some cultural competency, depending on what your individual organization is implementing. And I think that that's true for veterinarians as well. Anyone who's coming into communities, indigenous communities, as an outsider, you know, should be taking that on. And you know, I've got some of this on another, well, the next slide, but I really think that from a veterinary standpoint, you know, we have a responsibility to see ourselves as healthcare providers and see true partnerships with communities on these things as opportunities to engage in reconciliation. So we unfortunately don't talk about that, on the veterinary education side as much as we need to, at least formally. Informally, there's lots of discussion around it. But I do think that this is somewhere that we can really, make positive change and positive contributions as far as, undoing some harms that have been done. And Leah touched on colonialism a lot, and the role of colonialism in where a lot of communities are with their dogs. But I think that, veterinarians have a big role to play in engaging in reconciliation as well.
Mm-hmm.
So anything else for you to add, Leah, before we kind of finish up and move on to the last bit of discussion here?
No, I just want to invite everyone to check out Save Res Dog's website and sort of pass that on to anyone who wants to do more for dogs, because I have a little something for everyone. And in my resources tab, also I do have merch in there for sale, tank tops and all that sort of stuff. If you want to rep for res dogs, it goes to a good cause. All of this work on my end is voluntary. I don't make any money from it. It's just a lot of heart work that I put into it. And I've been able to juggle it into my schedule as I'm back at teaching. I'm a substitute teacher, and I have my 20-month-old baby and 2 dogs and partner with his music career. So it's just work that I will continue to do, so things can get better, I guess. So yeah, check out the website, and I have tips or resources for anyone.
Awesome.
Yeah. Mm-hmm.
So I know we continue to have lots of chatter in the chat box, which is really wonderful, and I think a lot of this has been touched on already. But the couple of final questions that we have for participants is, what strategies do you think would be most practical and useful for communities currently experiencing underservice or dog issues? And again, we've heard lots of this throughout the day, so I think a lot of that's come out, but if anybody hasn't spoken up who wants to, please do that. And then for any vet professionals in the crowd, what are some ways that we can push for changes that remove barriers for communities, to allow management of dog health with no local vet care? I think that's something that, more and more I think we need to get engaged in. So I'm curious what other folks have as ideas.
Mm-hmm.
And I guess we're ready for more questions from other people as well. If nobody wants to answer those questions that we had for you, if other people have questions for us, we're ready for that as well.
Mm-hmm.
It's Susan here. Thank you, Jordan and Leah. That was just fantastic. I can imagine that Sam is going crazy drawing with the richness of the material you've presented. It's just so extensive and broad, encompassing so many things. So thank you so much for doing that. We do have a few minutes for some questions or comments, so maybe I will let you take over the chat lines there, because there's 2 of you that can manage it.
Mm-hmm.
And
Yeah,
we can open it up to that.
One of the things that I just noticed and I responded to in the chat was Valley was talking about doing the Kairos blanket exercise and saying that Susan, you and Tessa had done that with the Northern Rotation up north, and we've certainly done it with our students as well for the last few years. And I think I agree with Valley that everyone should do it. So anyone out there who has not taken part in a Kairos blanket exercise, particularly if you're a settler Canadian, strongly recommend it. I know I've definitely had Indigenous students participating in my rotation who have also participated in the Kairos blanket exercise, and have felt that there were things in there that were really important learning opportunities for them. On the flip side, it can also, traumatize folks who have family history of, residential school survivorship and things like that. So just a word of caution there. That's one of the pieces of, I guess, criticism that the Kairos blanket exercise has received, is that it can re-traumatize people who already experience intergenerational trauma. So just a note of caution there. I don't know if you have anything to add about that, Leah.
No, for sure. I think I only did that blanket exercise once, but I feel like I'm an intergenerational survivor from residential schools because both my parents went, and so it makes me first generation in my immediate family not to go, which is kind of shocking because yeah, I still feel pretty young, and yeah, so that blanket exercise will definitely help bring some cultural awareness and sensitivities to communities if you're non-native, which is super important because it will help bring understanding and some trust, hopefully, in communities, because I know there's a lot of mistrust sometimes too, which needs to be worked on.
Yeah. Someone's mentioned, Terry Gillis mentioned here that the Indigenous Canada course through the U of A is free as well. And I know there was a lot of social media action around that course recently because Dan Levy was on Instagram promoting it. So I haven't taken that course, but I know others have said it's really wonderful. There's a group of folks at the U of S campus as well. Their group is called Indigenous Voices. They're part of the Guanama Center for Teaching and Learning. Maria Campbell is one of their team. If anybody doesn't know who Elder Maria Campbell is, you should. They've created some modules that are free and available on the U of S website as well, and I can find those and pass them on to the folks at Vets Without Borders to share with all participants later, because they're really good modules too, just taking people through some history, because that's part of what we need to understand, especially as settler Canadians, in this sort of truth and reconciliation process. We really need to have the truth part before we can adequately engage in reconciliation. So
yeah. For sure. I agree.
I'm just going to interject quickly. There's a few people sending comments that are only going to the panelists. So if you've sent a comment, make sure it goes to panelists and attendees so everyone can see it.
Yeah. Yeah, and someone said, oh, okay, Tessa just shared the Indigenous Canada course link to all panelists and attendees. So thanks for doing that, Tessa. There was another question here. It's already been said, but I think an effort should be made to change provincial regulations so that local vet tech and animal health folks could provide more services in remote and northern communities, and definitely agree with that. And so there's been some chatter about telemedicine and telehealth as well. And so I think that, you know, thanks to COVID, hey, a pandemic brings us some open doors in some ways. There have been some changes in legislation as far as what's possible for VCPRs, veterinary client-patient relationships in certain areas. And that's something that, again, in places where that hasn't changed thanks to the pandemic, those of us who are currently licensed vet professionals can push a little harder for our VMAs to make those changes so that we can actually engage in telehealth that's legal from a VCPR standpoint. So
I just wanted to say thank you to everyone for listening to us. I just went to my merch website and made a discount for anyone who wants to order any merch, and I'll put it in the chat for anyone who's interested, so to save like 10%. Merch orders have been very slow lately, and I just want to keep getting stuff out there. So if you use the promo code, and I'll put it in the chat right now, Save Reds Dogs 2020, you will get 10% off, and this is for the panelists.
wonderful. Thanks so much, Leah.
It's your stuff.
Okay, and Dr. Bender wrote, as a practitioner of One Health, totally agree that dog injuries are and should be included in any public health or environmental health program. Yeah, and I totally agree with that. I also agree that we should be talking more about this from a One Health perspective on the veterinary side too, because sometimes that whole conversation gets missed. And you know, One Health means different things to different people. And I think sometimes on the human health side, there's this, you know, disconnect between the fact that veterinarians are participants in One Health and even that community members are participants in One Health. So I think it's definitely something that needs to be broadened, that conversation around One Health. And there's also the concept of One Welfare that we need to be taking into consideration too. So anybody who knows about the National Link Coalition down in the States and the connection between, you know, violence violence against animals or neglect of animals and violence or neglect towards humans. I think there's a lot of discussion there. So when the welfare of animals is optimized, often the welfare of people is better too. So lots to happen there as far as what we teach to veterinary learners, and also sort of how we sort of approach these things from a community standpoint too. Yeah.
Yeah.
I don't know if there's anything else that that folks have that they wanted. There's some talk about telemedicine here, and that's wonderful. If there's anything else that anyone wants to add, I know that everybody wants to stay on time, and I see we're coming to the end of our time here. So.
Oh.
Wonderful. Well, if not, then I guess I would also echo Leah and say thanks everybody for listening to us, and thanks for all the great discussion. I wish that I had been able to pay more attention to it throughout the presentation, but there's been lots of richness there, I think. Yeah, please feel free if anybody wants to chat with me for any reason. My email address, I'll just put it in the chat, but it's jordan.woodsworth@usask.ca, and this is the thing in my life that I love talking about the most. So if anybody wants to have more discussion around this, I'm open to that as well.
Yes, thank you everyone. I just feel like we're in a crucial season right now because winter will be coming soon, so especially in the prairies, so it's almost a state of emergency for res dogs pretty much. So keep doing the good work that you all are doing, and thank you very much.
Great. Thank you too very much. Really, I just took a few notes about how you've taken us through how the history of colonization has affected interactions among people from communities and from the South, and also dog care and the critical importance of reconciliation. You've given us an example of just an amazing program that is led by you, Leah, Res Dogs, and I think it's a great program, and it would be interesting to see if there's ways to expand that and foster it with other indigenous communities that are interested across the country. I think it's a great example, and kudos to you for doing such an amazing job. You've talked lots about, the first aid issues, and the chat line has been full of comments about ways, with online resources and telemedicine. And I think COVID has, as you said, Jordan, COVID is probably going to facilitate that. So COVID, I think, has brought some good things and made us realize we can work in different ways. The youth was emphasized and the importance of that, and I'm excited to see that we do have some youth online here today, and that they are going to be the leaders in the future, and the more we can involve and provide opportunities for them to learn more and role models, I think that's fantastic. Lots of things around repro health and population controls or population management, and the challenges and the effects that can have on communities, and also on human health, mental health and welfare, and so the whole One Health concept. The survey that Leah, you did of the communities across Saskatchewan, I think it's really a neat thing, and the responses that you got tell us a lot. And I guess one of the reflections I had is the fact that we have dogs and animals are important to everyone, but often they fall through the cracks because nobody's really responsible for them. And so it does take a lot of different organizations to come together, because there's not a single one that is responsible for it. And those are a lot of the challenges we face, right? When you say talk to a community and they don't even know who do we talk to? Who do we talk to about this? So I think that's really a key point. And then the issues around bylaws, and in different scenarios, that's different. As Scott had mentioned, in a lot of First Nations and on-reserves, the reserves can take control of that. It doesn't matter what the province and feds say in other places, that's not the case. So yeah, a fantastic talk, lots of cool insights. And like I say, I'm really looking forward to seeing Sam's visual of this. It'll be fantastic. So,
Me too.
I guess I'll leave it at that. We have 10 minutes for a coffee break. We'll start the next session with the door prize.